my name is Maya Vadiveloo, and I'm an associate professor at the University of Rhode Island in the Department of Nutrition and chair-elect of the American Heart Association's Nutrition Committee. And today, it's my honor to be here with Dr. Harnois-Leblanc to discuss some interesting findings from Project Viva.
Thank you, Maya.
Is there anything you want to share just briefly with our audience at AHA Epi Lifestyle 2024 about your main study?
Yes, so we did a cohort study with Project Viva. It's a pre-birth cohort of pregnant women recruited in Eastern Massachusetts, and we look at the offspring consumption of sugar-sweetened beverages and fruit juice intake throughout childhood, and we looked at whether higher consumptions of these two beverages would be associated with glycemic traits in late adolescence. And what we found is that it was in males that higher consumption of sugar-sweetened beverages was actually associated with higher insulin resistance level, as well as fasting glycemia and glycated hemoglobin, while in females, the associations were a bit more unclear towards the null.
Yeah, no, I found that sort of sex difference pretty fascinating, where, like you said, there was a signal in girls that both sugar-sweetened beverages and fruit juice were associated with glycemic parameters, but it was really significant in boys. And I was wondering if you had any thoughts about what might be going on. What are some of those biological differences?
Yeah, it's very a good question, Maya. And indeed, the signal in females was really attenuated compared to males, where it was much more salient. And I think that it could be due to behavioral differences between both sexes and also biological differences, especially during those pubertal years where we see more differences growing in adiposity and insulin sensitivity in males compared to females. And also in females, we didn't know exactly for what behaviors SSB would be substituted for. So maybe it's why we didn't see as much signal in them.
Interesting. So, in terms of, you mentioned the different pubertal ages as well as behavioral differences that might happen. Are there things that you've noticed in that cohort that might signal some of those behavioral and/or biological differences?
So in the cohort, when we looked at the trajectories of SSB's consumption, what we've seen is that although it increases in both males and females, in adolescents and females, it's kind of plateaus, while in males it continues to increase up to later in adolescence. And also not from that cohort per se that I haven't looked at it already, but we've seen another cohort that are really representative of the general population in US and Canada, that boys and adolescents tend to have more screen time, but to be more active than girls. So maybe that's also some explanation in the related lifestyle factors with SSB's consumption.
Yeah, that makes sense. So it kind of corroborates some of their declines in physical activity as girls get older, and perhaps maybe greater focus on different health behaviors. I guess I'm wondering what your thoughts are. We see sometimes in self-reported diet that women, at least adult women, are more likely to underreport certain categories. Do you think that we could be seeing any similar trends with adolescents?
Yeah, I think it's really a good, one of the most promising explanations too, because although it was reported by the mother, the consumption in childhood years in both sexes, after that, when they were teens, they would self-report their sugar-sweetened beverages and fruit juice intake, and maybe males, they would over-report or have more error, whilst females tend to more under-report or be maybe more aware of their own consumption and behaviors and health outcomes.
So switching focus for a little bit, just given everything that's been discussed at this conference on social determinants of health, I guess I'm wondering, what do you think are sort of the implications for what we should be communicating with parents and with kids about sugar-sweetened beverages, and also about 100% fruit juice, which is sometimes separate, sometimes included in our definition of beverages and whether they should be consumed?
Yeah, indeed. Sometimes they can be all together in the definition of sugar-sweetened beverages and sugary drinks. Sorry, and so the findings are in accordance with a recommendation from the Academy American Academy of Pediatrics, where we need to really reduce sugar-sweetened beverages and limit fruit juice intake in children. However, although we can do more education on the individual levels in the children, the parents, and in schools, but I think that overall there might be more bigger, larger policy and that should be implemented, and also some addressing SODH to really favor the access of whole foods instead of fruit juice and sugar sweetened beverages, for instance, or to favor more water drinking and so.
Yeah, couldn't agree more that if we make the default the easy option to be
That's it,
healthy,
yeah.
that can make a lot of dent in these problems.
Yeah.
I guess any final thoughts that you might have about next steps with this research, or where you'd like to see this go, or something that I should have asked you that I haven't yet?
I want to look if there would be maybe differences across some subgroups of the population based on income level, let's say at on the household level of or race and ethnicity. I might not be able to do it in the cohort because the sample size is a bit limited. I tried actually, so I might look to other cohorts, or otherwise I'm really interested in looking at fictive hypothetical interventions in cohort settings, and I wonder if there's one that we could verify at more at the policy level, where we would actually limit accessibility to sugar drink and favor other substitutions that are healthier and more in accordance with guidelines.
Well, thank you so much.
Thanks a lot.